This telehealth cabin connects qualified doctors with patients all over the world. About a decade ago, French Dr. Franck Baudino was providing primary medical care to isolated communities in small African villages, which sometimes took 2 or 3 days' travel to reach. Exhausted, and with demand for accurate healthcare consultations spiraling, he vowed to create a sustainable solution that could bring professional medical diagnoses to the global population. That knows you're sick before you do. IBM's 5-year plan to remake healthcare. A mix of artificial intelligence and custom silicon could help people diagnose themselves with a range of conditions before they show symptoms. Read more. It wasn't possible to carry on like that, he tells ZDNet. I wanted somehow to be able to take the pulse of the world. CIA data shows that low-income countries have 10 times fewer physicians per capita than high-income countries. Nigeria has about 4 doctors per 10,000 people, while Ghana has only 1 per 10,000. By comparison, European countries, such as France, have around 30, while the figure increases to 40 in Norway and Switzerland. Yet even in developed countries such as France, there are plenty of areas where some of the population, particularly those in rural areas and the elderly, are left with inadequate access to healthcare. The issue of medical deserts in the countryside has long been a problem for the French government. Having decided that it was important to find a way to provide remote consultations, Baudino founded H4D, or Health for Development, in 2008. Initially, he tested several devices, but the results left him dissatisfied. I realized that even with the best device you can't have consistent measurements because they depend so much on other factors, like the environment and design, he explains. To put his plan back on track, he defined 3 essential elements for remote consultations. These were, quality of measurement, a sustainable point of care, and recreating an atmosphere of confidence. 7 years later, after some intense R&D and a few setbacks, Baudino invented the first connected medical office, the consult station. A standalone telemedicine booth, which is 191 centimeters long, 121 centimeters wide, and weighs 285 kilograms, 6 feet 3 inches, 4 feet, 628 pounds. The consult station is a patented and certified Class IIM medical device, which meets the requirements of European Directive 93/42/EEC. Its white, clean design gives it the look of a hygienic, yet comfortable, hospital consultation room. Inside, it offers professional medical instruments, screens, and a video system for communication with qualified doctors. The consult station telemedicine booth offers professional medical instruments, screens, and a video system for communication with qualified doctors. Guided by the doctor, a patient can use the equipment to perform a wide range of health checks, including measurement of vital signs such as blood pressure, pulse rate, blood oxygen level, height, weight, and temperature, using an electrocardiogram, listening to the heart and lungs with a stethoscope, testing the skin with a dermatoscope, and the eyes through a fundus camera. There are also visual and audio tests, and blood glucose level monitoring. It works well. We've tested thousands of patients and 87% say they forget after 3 minutes that they're with a remote doctor, he says. But one of our biggest challenges wasn't the technology. It was writing the clinical protocols with a core group of expert physicians, on how to guide a patient to use the devices. When used properly, the range and quality of the devices inside the consult station allows a physician to treat 90% of common illnesses. We have to exclude areas such as emergency care, psychiatric problems, some stomach pain problems, and injections, he says. By comparison, a physician by phone is able to effectively treat less than 3% of diseases. Access to the booth requires secure patient authentication, so in France that means the Carte Vitale Health ID card is required. A prescription is delivered through the machine to the patient at the end of the consultation, and the data that is produced during the consultation is encrypted and accessed by the patient through a secure online database. In France, the consult station can be found all around the country, including the Paris, Provence, Saint-Étienne, and Toulouse areas. There are around 50 qualified physicians working across 3 platforms in Cannes, Toulon, and Paris. We are not waiting. Diabetics are hacking their health, because traditional systems have failed them. Diabetics have been waiting for years for better technology to manage their condition. Some got tired of waiting and hacked together an open-source hardware and software solution. This is their story. Read more. Every single doctor providing teleconsultations is a licensed practitioner in France, either in a general family practice, clinic, or hospital, and they spend 2 to 3 half days working for H4D. The booth can be positioned anywhere, such as a workplace, hospital, nursing home, or student residence. Baudino